Welcome, everybody. Thank you so much for joining us today for our monthly Community Mental Health Transformation webinar. I'm Megan G, the Communications Manager for the programme. I may be a familiar face to some of you, but if not, lovely to meet you all. And today we're going to be giving a bit of an update on a piece of work that we've been running within the Community Transformation Programme, which has been looking at the language that we use within the context of mental health services and the system more widely. And we wanted to kind of bring an update to you all today to share what we've been doing so far, what our initial learnings have been, and what our next steps are within that project. So I'm glad that you're all interested in this work and have come along today. Just a little bit of housekeeping before we get started. So the webinar is being recorded today. We found that quite a few people quite like to watch them back and share with their colleagues. So because the webinar is being recorded, if you would rather obviously remain anonymous, please feel free to obviously keep your camera off and to rename yourself. That's absolutely fine. Don't feel obliged to have your camera on if you don't want to. But equally, we obviously very much would like to encourage you to be involved as much as you're happy to be. You can turn on live captions for the webinar, if that's helpful for you. Along the bottom of the screen, there'll be 3 dots. If you click on that, and it gives you the options to turn on captions, if that's helpful. And we've got quite a condensed presentation today because we wanted to make sure that there was ample opportunity at the end of the session for us to open up to the room for any questions or suggestions that you might have. So there will be an opportunity at the end. But equally, throughout the session, if you do have any questions or anything you want to add, feel free to raise your hand or add anything into the chat box or into the Q&A box. I'll be keeping an eye on that throughout the duration of the webinar. So do feel free to obviously get in touch and engage in whatever way you want to today. And then later on this afternoon, I'll send round the slides from today, as well as kind of a summary of what we covered. And there'll also be a link to a short survey, which we'd really appreciate if you can complete. Just really helps us to make sure that these webinars are continuing to be useful for the people who are attending. And if you've got any ideas of topics you'd like us to cover, please obviously put that in the survey. As it just really helps us. And then lastly, as I say, we do record all of the webinars and we've got quite a collection of them now on our YouTube playlist. So you can get that playlist by scanning the QR code. This will also be included in the slides I send round. So if there's any of the previous webinars you weren't able to attend or ones that you particularly enjoyed and would like to watch back, they'll all be available there. Okay, so that's all the housekeeping bits done. And I'd now like to introduce our presenters who are joining me today, Tasha and Jonathan. Would you like to introduce yourselves?
Thanks, Megan. My name's Tasha Barefield. I'm a lived experience coordinator with Possibility People, and we've been supporting the engagement of people with lived experience and carers in the transformation programme for a couple of years now in Brighton and Hove, and more recently in East Sussex.
Hi there, I'm Jonathan. I'm Transformation Director and I work at Sussex Partnership Trust, so the big mental health trust in Sussex. And my job's to sort of, I guess, have an overview of all the transformation work we're doing in the trust. The biggest transformation programme is around adult and older adult community services, and that's where this work emerged from, but we'll talk a bit more about that in a sec.
Thank you both. So Tash is going to start off the presentation for us to kind of take us back to the beginning of where this work started and kind of the early sessions that we ran. Thank you, Tasha.
So we've been working with people with lived experience for a couple of years now, and we noticed there was a common theme around people expressing the language that was being used in mental health services, and it not always being that helpful for people's own journeys and their contact and communication with services. And it can actually act as a barrier occasionally as well for people who want to access support if they feel that they're being labelled or the language that we're using can cause them harm, essentially, sometimes. So we started a conversation around February, March time, the beginning of this year. We started off with 2 focus groups, one online and one in person, which was a great opportunity for people to come together. We had staff, commissioners, people with lived experience, carers, anyone who was interested in sort of mental health language, come and join us for those focus groups. And then after the focus groups, we then moved into workshops where we actually looked at some of the findings that had come out from the focus groups and looked a little bit more carefully around what we wanted in terms of actions to change language going forward. The focus groups were well attended. I think the virtual one, obviously, a little bit more, but there was something happened in the in-person workshops and focus groups which really helped people to understand everyone's point of view in the room. So they were really, really valuable to be able to offer that in person as well as the virtual options. And so out of the focus groups, we asked people to look at language and words that they felt were harmful or that were unhelpful for them. And these were some of the language that came up in terms of, and I think you can probably see the ones that are the biggest ones in the word cloud. So these were taken from the focus groups, and people were telling us these are the sort of things that are not helpful for them to hear when they're engaging with our services, particularly around things like resistant and unstable. Disorder came up quite a lot. Discharge was being discharged from a service. That felt like that was a really big theme that people felt it was not helpful to their journey in terms of moving forward and having a good experience at the end of a service when they were working with people. And there are some other bits of language as well in the word cloud around that we use quite often behind the scenes as part of our admin around non-compliant and referral and comorbidities, and language that I think sometimes gets passed over to the service user or the carer that they don't really understand what that means, or they wouldn't want it referring to them personally. So there was a really good discussion around all different types of language that we use within that space. And then, so the summary of some of the feedback that we got from the focus groups is the language we're using for non-English speaking services for people uneasy to understand? And I would add, for any person using services easy to understand. I think sometimes we overcomplicate our language, and it's at a level where people need a dictionary sometimes to understand what we're saying. So I think that was a really important aspect around people who don't speak English or have English as an additional language as well, to make sure that we simplify things as much as possible so they understand the services we're delivering. Abbreviations were brought up as very confusing, and often abbreviations mean different things to different people. In different services, we use the same abbreviation to mean different things. So that can be quite misunderstood. People can not understand that. Are we also engaging services the way that they would want? So there was a lot of feedback from people saying about how to access services, and is the language we're using causing a barrier to that? We should ask people how they want to be addressed. So we had a discussion around, do we want to be called patients or clients or service users? And we were just saying that people should say how they want to be addressed, and using their name more often than not, which is a general principle that just personalizes the person that you're working with. We also recognize that we're not always going to get the language right for everyone all the time. There was a real clarification that around some of the words we use, some of the terminology, what works for somebody doesn't work for someone else. So there were examples in the room around somebody saying, well, I really don't want to be labelled with that diagnosis, and someone else saying, actually, I find that diagnosis really helpful and really supportive for me on my journey. So there's just that reflection, I think, that it's going to be a complicated process to try and make sure everyone feels welcome. And yeah, this idea around changing the word discharge to managing independently. And I know that we've been talking a bit like warm handovers as well. That's another one that we could maybe say, instead of discharging someone, that we are sort of signposting them or handing them over to more universal services at that point. So that was, yeah, some really excellent feedback. And then I'm going to pass over to Jonathan, who's going to tell us a bit what happened at the workshops.
Thanks, Tasha. That's a really helpful introduction and a bit of context setting. So as Tasha explained, we followed up the focus groups with some workshops where we could really build on those initial conversations and start to think about what are the principles that we want to work to. And what we've summarised here are the principles that we agreed on coming out of the workshops. And that's not to say these are set in stone and we shouldn't build on these and develop these further, but this describes what came out of that initial bit of work. And really what we want to do is check out with people, are these the right principles we should be thinking about, and how might we build on them. So we've separated out into language we should use and some thoughts on what we shouldn't do. In terms of what we should do, we should make sure the language we use is inclusive. So it really talks of, I guess it comes on to that second point. It really talks to the person as a person, not as a diagnosis, not as a descriptor of the person's appearance or things like that, but is really about the true person and what their needs and wants are. That it's clear, accurate, and honest. Obviously, honesty is really important along with accuracy, and we don't always get that right. But clarity is really, really important, as Tasha said earlier in relation to the language point, is it needs to be easy for everyone to understand. And the last point we thought about language is it needs to be adaptable. We had, just to use an example from the workshops, in one workshop and I don't know how to correctly refer to people now, but we had one person who had a diagnosis of autism say they like to be described as a person with autism, not an autistic person. And at the next workshop, we had someone also with a diagnosis of autism say they'd prefer to be described as an autistic person, not someone with autism. And I think that just illustrates that we all have different preferences and different ways we want to use the language. And the important thing I took from that, and I think other colleagues did as well, is that we should check out with people how people want to be described and how they would want language described to them. So that's what we should be doing. And then we also picked up on things that we really shouldn't be doing. We talked about negative and disrespectful language. For example, again, this came out in one of the workshops, is someone said in a letter that their psychiatrist wrote to their GP, they were described as being well kept. And they found that disrespectful because that's how they lived their life. They always took pride in their appearance and they would always be well kept. And they thought the fact that the psychiatrist felt the need to describe that was disrespectful. Obviously, anything that's unclear and confusing, and there's something around how we help each other really make sure we are clear and not confusing in our language. And unhelpful language, and I guess that example of being unkempt was seen as unhelpful. There's plenty of other examples. I'm sure people on this call wouldn't have a problem identifying things they found unhelpful. So that just gives you a sense of the principles we thought we should work to. But as I said, we really want to develop these and evolve these further. Shall we move on to the next slide? So what I found helpful coming out of the workshops is really to think about 3 areas we might want to focus on and then what we wanted to do next. So the three areas we thought where we could really start to make a difference was how we start to describe our processes. So Tasha gave some really good examples around discharge and how we might want to describe discharge differently. Another, a really good example we heard about was one team that got feedback from people who used that, who'd accessed that team's services. And they had feedback that assessment was a really unhelpful term, because people would get a letter, that was their first contact with the team, and they would invite the person in for an assessment, and people thought, oh, am I going to pass or fail this? You know, and people got quite anxious about that. So that team really took that on board and changed their language in their initial letters to, well, I think that they call their first appointment an initial appointment. So they took out that phraseology around assessment, and people felt more comfortable. The feedback they got from people using their services was they felt more comfortable with knowing they were going in for an initial appointment rather than assessment. Secondly, there was, how do we describe our services? So ATS is a brilliant example. I don't know if everyone on the call knows what ATS is. That stands for our Assessment and Treatment Services. Most other parts of the country call them community mental health teams, which probably describe more what they do. But there's something about how do we describe the components of our services, the different teams in our services, in a way that's easy for people to understand. A similar example is around Pathway. So we use Pathway a lot in our services. And again, I could probably go to each of you on this call and ask you what you think we mean by Pathway, and I expect we'll come up with more answers than there are people in the room. So there's something about how we describe our services and how we can really say, you know, I think in an ideal world, our services should be called what they do, so there's no misunderstanding. And then lastly, and I think this sings to the point I mentioned in relation to the previous slide, is really checking out with people how people want to be described, particularly in some of our formal documentation. So, for example, the letters that a clinician might write to the person or to their GP or to social services or whatever, really checking out how people would like to be described, and that includes things like diagnosis. Some of that is, you know, it is internationally understood descriptors that are important in conveying some information, but we can also take on board what people using our services would like to hear. And you know, I think more importantly, a lot more around how people are described in those services. And then lastly, we started to identify what are the actions we want to take forward out of this group, and that was really the phase we're at now, which Megan, I'll hand over to Megan to start to let you know what our thoughts are around the actions we could take forward, and would really welcome feedback on that.
Thanks, Jonathan. Thanks again, Tasha, as well, for just bringing us up to speed as to kind of what we've been working on so far with lots of others who have been involved in this work. So some of the initial actions that were identified in the workshops, you know, what are some of the tangible things we can start to look at and to think about to start to make some of these changes, not just within our services, but within the system and across Sussex, and to really start to come up with some of those tangible things. So letters were something that came up quite a lot, and the language used in letters and how it can make a person feel, either, as Jonathan said, you know, some of the language can make a person feel, you know, quite uncomfortable with the way they're being described, the way they're being referred to. There are also examples of how a person was almost described in a way that as though they were never going to see it. It's almost as though it didn't actually concern them, but then a copy is sent to that person and the letter is about them, and just how that can make a person feel, and how that can make a person feel like they're not involved in their own care. So yeah, we had a big conversation about letters and you know, those like initial appointment letters, you know, the language used in that, you know, is it friendly, is it informative, is it easy to understand, and also looking at letters when somebody is already receiving support. So for example, if somebody doesn't attend an appointment, if they're not able to contact them and they send them a letter, what's the language like in that letter? You know, is it going to make the person feel almost like they're being told off, or is it more supportive language? You know, trying to find out why somebody might not have been able to attend an appointment, and just looking at those sorts of things. We thought actually letters is something that is a physical thing that we could look at and start to implement some of those changes that would hopefully make a really positive impact on a person's experience of accessing support. So that was the first one. The second action was just to have a look at what other organisations and other parts of the country have done around language. In preparation for the focus groups and the workshops, we had a look to see what others have done in the context of the community transformation programme. And there are some other trusts and parts of the country that have started to explore language. But from what I've seen, it looks as though they have maybe come up with a list of, I guess, the words that you absolutely would not ever use and what their replacements would be. But I think I'd be right in saying that what we're looking at with this project is something much more around that cultural change, rather than kind of a list of like do's and don'ts, but more that kind of guiding approach as to how we can adapt our language to be much more supportive and much more inclusive of the person that's sat in front of us. But there are some good examples out there. And for example, we've come across a language guide that Oxfam developed. And obviously that is specific to the work that they do, but some of the examples in the approach they've taken, I think, could be really well suited and adapted to the work we're doing here. So yeah, we're having a look at those things and thinking about how we could implement that in Sussex. And then picking up on one of the things that came up in the focus groups, you know, are we communicating with people in the way they would want? Also, this isn't just about, you know, words on a page. Can we communicate in a more visual way for people who perhaps don't want to read through a service leaflet? You know, can we think a bit more creatively about how to communicate and engage with groups and people in a different way that will work for them? So thinking about things like short videos, podcasts, animations, you know, keeping it really simple, clear, without any jargon, so that everybody is given the same opportunity to access that information, to hopefully help them in you know, either a service that they're looking to support, or just getting some advice or guidance. Just give everyone the equal opportunity to be able to access that. And then we thought something around training and skills. So to be able to incorporate some of this within inductions for new staff, and, you know, for there to be, you know, specific training modules for, you know, for staff and clinicians working within the health and care sector, to get people thinking about language and the impact that language can have on a person and their experience of services and seeking support. So that's something else that we thought we could actually look to do. And then lastly, we recognise that this is an ambitious piece of work, but I think it's important that we are ambitious. And it was really evident in the focus groups and the workshops that people feel really passionately about this, and that there is a real need for us to improve and adapt the way that we're currently using language, and to really listen to what people are telling us. So I think kind of a long-term ambition would be for us to establish a consistency in the language that we're using across the whole of our health and care system in Sussex. And I realise we'd have to start small, but to build on that and to get that buy-in from all, you know, organisations and partners in the system for us to use language in a different way. and a better way. So that's kind of some of the initial actions. And then just to share some of the other things we've been doing outside of the focus groups and the workshops that happened at the start of the year. As I say, there was a huge amount of energy in those sessions, and people were really engaged in this work and wanted it to be far more than just that kind of one-off session. So what we did was we contacted everybody who had attended those sessions and invited them to become part of a reference group to be able to continue this work. And the response, the group is so much bigger than we anticipated, but it's fantastic because you can see that there is a real enthusiasm and drive for us to continue on this work and to see it realize into something really meaningful, and to have that positive change. So the reference group has been formed, and we met for the first time in July. We're meeting again at the start of September, and because we've only met once, it was just kind of establishing what the what we want that group to be, but we started off looking at some of those examples of letters that we currently use within services, and to think about how we could change those and to come up with something a bit more standardized. And in our next session, we're going to be looking at how we can really take a trauma-informed approach to the use of language and to all the work that we do within this, to really ensure that we are considering, a person and their needs, and as Jonathan said, thinking about the whole person rather than a diagnosis and those kind of labels that I think we can sometimes use. We've also had some kind of bespoke sessions for specific groups. So we held a session with our specialist older adults working together group, which was really great just to get that insight from a different group of people who access our services, to see what sort of language doesn't resonate with them, or what their experience of language has been within services. And that was really, really interesting. And we also went to Team Springwell, which is a project for adults with learning disabilities, which gives them the opportunity to be able to get involved in co-production. And it was great to be able to go and meet with them to again get that different perspective for what it's like for them accessing a learning disability service, and the sorts of language that is used within letters, appointments and things like that. Again, just to try and give us a fuller picture as to what the current issues are and what we need to address. Our VCSE colleagues have also been providing us opportunities to go to their network meetings and to be able to share this work with the VCSE and to be able to encourage them to get involved as well. And next week, we're also holding a session with Sussex Interpreting Services with a small group of people who speak languages other than English, to be able to again give us that insight and to be able to look at what we're currently doing and to be able to share their perspective as to how our language is landing with them and their communities, and to also have a bit of a look into how that the sort of stigmas that can be in certain cultural groups, and how we could use language to connect with those groups more effectively. So yeah, that will be a really interesting piece of work and something that we were obviously really keen to make sure that we were building on. So there's been quite a lot going on, as you can see, but that's all for our presentation. I'm now going to hand over to Tasha, who is going to kind of open up to questions and your thoughts. Thanks, Tasha.
Thanks, Megan. Yeah, so we wanted to take this opportunity for you to ask us some questions about the process, or give you any feedback, things to inform you about what we're doing and what we're planning on doing. But we also thought it was a really good opportunity to say, to ask you some questions about how and what do we really need to change, how do we change language that we use, how do we ensure that people's involvement in this process actually influences our services and the way they use language. and how do we spread this message far and wide? We know with working from the reference group that has to be a partnership approach. It can't be something that, you know, Jonathan, Megan and I go away and we create something and we expect everyone to come along with us. We need to make sure that we are spreading this message and we're working with people in partnership. And this is really going to be a joint approach for the whole of Sussex and people working within mental health to do this together. So we'd really just be interested, anyone have any ideas about how we could look at some of these issues, and where we could go and how we can make sure that the language it's a culture shift. We totally understand that, but how can we make sure that the people working in mental health services work alongside people that use them so that we can change that language for the future? So I will leave it open to you to ask some questions or any comments or answers that you have related to this. Debbie, I believe you've got your hand raised.
Hi, yeah, thanks. Really interesting to hear that you're doing this work. So I'm West Sussex Mind, by the way. I think it is really important. I mean, it's something that I'm communications manager at West Sussex Mind, and I think it's really important work that you're doing around language, and it's something that people like Megan and myself that have been in communications are always trying to do for the public, is to put things into the right, phrase it in the right way and use the right terms. What I was going to suggest, because we find it here as well, people talking about accessing services, instead of getting support or getting help, are you looking to access our services? No, are you looking to get support? It's just putting it into plain English and making it simple and say what it does on the tin. I wondered if where you're doing your training and induction stuff about this, rather than it being, and maybe you're thinking about this already, I'm not sure, rather than it being here's, you learn the job and this is how we talk to each other within the service. But when we're talking to the people we're supporting, we're using these different words and we're not talking about accessing services, for example, whether actually it's about learning how we talk within those services to each other. For example, we also talk about service users, and I'm like, no, anything that's going to the public, you're not a service user, you're a person that gets support with us or whatever, and it's not about using services, it's about getting help. So whether it's about changing the culture of how we talk to each other so that it becomes instinctive. So if you think about all the new staff coming in, it becomes instinctive that you don't say the word service user at all in your job. Not just when you're talking to service users. You see what I mean? Does that make sense? I don't know what you think.
That really does, Debbie. I really like the way that you completely flipped that and changed the perspective. And I think we've all been thinking, oh, well, what's another term for service user that's friendly? But actually, it is people that use people that need support. I think that's an absolutely right way to look at it. And I think I totally agree with you about changing the culture from within. And I think we do need to make sure that we work with staff to change their behind the scenes language as much as their front of scenes language. I think I think that's very true, because I think it permeates, doesn't it? It will, if you change the way you use your language every day, you will automatically use that language when you're working with people that need support as well. That's really helpful. Thank you so much, Debbie. All right. Susanna, you've got your hand up next.
Thank you. This was really brilliant. I work for Carer Support West Sussex, and part of my role is mental health lead for carers of somebody with serious mental health illness. So from my perspective, in terms of representing carers, and what Debbie actually mentioned is really interesting, are there kind of people who are accessing, because carers of somebody with a serious mental health illness would actually, for you, be the initial client, because a lot of people with serious mental health illness will not engage or will not even acknowledge that they have a mental health illness. So for them, again, interestingly, the language is really important. Are they accessing your service? Well, they're not. Are they there for the information? Yes, that's probably what initially all they want. Are they getting support or just asking for some help to support a person with a serious mental health illness? I think you're doing a grand job, and I think there's a lot of scope again for professionals as well as whatever we decide to call patients, service users, expert by experience, etc. So I'm really looking forward to see how this develops. The other thing that struck me, and Megan mentioned this, it's like, is it just the language or is it the visual? So for us here, mostly, I think today's possibly professionals who are attending. But one thing that struck me with the entire mental health transformation that we're going through in the entire Sussex, it can be very disorientated. So for me, for example, I attend the housing webinars, which are specific issues for our carers, looking after people who are experiencing issues with housing. I attend VCSC meetings. I attending this for the first time today. So what I'm wondering whether it will be helpful, because it's very difficult to remember who everyone is and which team it is that we're working with. I work very closely with SPFT and do a lot of care awareness training to a lot of teams. And probably in the last 2 months, I've done probably 20 sessions to different teams. And I know at one point, and I think it was BCSC that shared the diagram of the structure of who sits where. So before perhaps each meeting, can you create a one-pager to say, for example, your team today, this is where you sit in a structure? Because it's really difficult. I mean, I have to go to Megan all the time, and she probably has like millions of emails from me being confused. Which meeting is this? I do have a ticket for this, but I haven't got a clue where this is, etc. So maybe just like a little one-pager before every presentation to say, this is our team, and this is the whole transformation, the community mental health transformation, kind of where, so like a little dot, where are you sitting, so that we know where to go to back for the information if we need for our clients or for our carers in this particular instance. It's adding more work to the amount of work they're already doing, but just an idea. So, but thank you very much. This was really, really informative.
Thanks so much, Susanna. That's so important. And yeah, it's a very complex structure, I think, in terms of making sure that you know where your involvement is. And we are creating some resources around visually identifying that. So hopefully that will come out soon to you, and you'll have a clearer picture. Thank you. I want to make sure everyone else gets a chance to say what they want to as well. If we run out of time, please just put it in the chat, and we can send that round out afterwards. But I'm going to go to Joy next.
Oh, hi, I'm from Hastings, and rather ATS acronym. It's really good to hear that the work that's happening around kind of use of language, because actually that's come up a lot within our service quite recently, particularly in the outcome letters from appointments, where the language being used has, I think some of the feedback I've had, I think is through complaints as well, is that it's felt judgmental, or it's not really described what the individual was going through, or there were some assumptions within that, and some of that is the language that we use day to day. And I guess from some of that, we've started a diversity and inclusion work group, and it's about accessibility. And we kind of feel a bit stuck. And I think it's really good to hear about this today. So I'm really excited in terms of where do we really start? And I guess we were thinking of the front door in the language and the leaflets, and making sure that we're representing the community that we're based in. And I wondered if there's things perhaps, or who I might go to really, to kind of think about that or get support, so that the things that we are working towards will align with what the trust is already doing, or what community transformation is doing. Then we're not separate, really, I guess was my comment.
Yeah, I'm happy to come in. I think that sounds brilliant that your team and the service are thinking about this work already, and trying to action some feedback that people have shared with you, that the language isn't quite right. In terms of kind of who to share that with, I'd be really happy to work with your team, to look at what you've got so far, and to be able to offer some input to help with how we could develop those. and then we could maybe take them to the reference group and say, this team have developed these, and would you be able to give us some feedback? A lot of the members of our reference group are people with lived experience and carers, which is fantastic, so they can give some really, really useful feedback. So yeah, I'd be happy for you to contact me directly and support in the work.
Very pleased to hear that. Thank you.
I was going to say something similar. I thought, it sounds like you're being a bit of a trailblazer there, Joy, and I think that's really exciting, and we can use the reference group to test things out and set the standards for other teams. So, as Megan said, would really, really welcome working with you on that.
We've got time for one more, Megan.
Yeah.
Go to Jane.
Absolutely.
Jane, we'll go to you last. You can finish.
Hi there. So I'm Jane. I'm a nurse by background, but I work for LGBT Switchboard in Brighton and Hove. And I was just thinking that so much, it's a really brilliant piece of work. And I'm thinking that so much resonates with LGBTQ inclusion and, finding a person-centered language and that critical first kind of meeting with a person and knowing what they, how they wish to be known as, who it is that's with them. And I was just thinking, are you joining up? We do health inclusion in primary care, and I think we in the past have done it in one of the hospitals. But I'm also thinking about Mind Out. It might be worth having a focus group with Mind Out, which you may already have planned. But I'm thinking of particularly the challenges that trans and non-binary people have at accessing services. We know that LGBTQ people have a much higher than average mental health needs. And also going back to what Suzanne was saying is that sometimes there's overlap. So we also go to a lot of different meetings. But it's really good because we can also start using that language, and maybe changing the way that we, talk to our service users or people. So yeah, that was just a couple of things really, but yeah, really brilliant piece of work.
Thank you, Jane. That's really, really helpful. I've made a note because I'd be really interested to find out more about some of the work that you're doing in your organisation, but also, as you referred to, Mind Out as well. And I think it's important to say, and I should have said earlier, we're aware of colleagues in other parts of the system that have also been looking at language, and we are now trying to bring that together. So, for example, I know that within Sussex Partnership, they've been doing some work looking at language in around like waiting times, but there's also a piece of work that Changing Futures have been leading on in the trauma pathway, which is looking at language within the context of mental health. So we're trying to bring that together because there's some really great kind of pockets of work happening. So we're trying to bring it together so that what we end up with is something consistent that will then hopefully be much clearer for people to access information and support. But I think what I would say is, if there are examples in the organisations that you're here representing today, or groups that you're a part of, that and you would like to be linked in with this work, or there's groups that we should be going to, please, by all means, I would recommend you to get in touch with either myself or Tasha or Jonathan, so that we can make sure that we are speaking with all of the key groups that want to be involved in this work, because, as Tasha said, this is very much a collaborative piece of work and not something that we can or should do on our own. So yeah, please do let us know of where we should be going and who we should be speaking to. Thank you, Jane. Okay, so I think that's probably all we've got time for in terms of questions. Please, if there are any questions that you hadn't had a chance to ask, or if you're having your dinner later and you think, oh, I should have asked this, please know you can contact us anytime on the community transformation@spft.nhs.uk email address. that will be where the correspondence comes around later today. So feel free just to reply to that email. Within that, there'll also be details about the next webinar, which will be on the 20th of September. And the focus of that webinar will be sharing an update as to how we're getting on in developing a specialist community rehabilitation pathway. So do sign up if you haven't already and come along to that one, as it will be obviously great to hear about how they're getting on, their progress within that work. Yeah, I'd just like to thank everybody for coming along today. Really appreciate your support and your questions and your comments. Do encourage your colleagues to watch this back if they weren't able to attend. And just reiterate, if you do want to get involved with this work, do just send us an email, because we'd love for you to be involved. Thank you, Tasha and Jonathan, for leading us through the presentations today. And thank you all. Have a lovely afternoon.
Thank you.
Thank you. Bye-bye. Bye.